Hi guys, welcome back to Sick Conversations. Today we're joined by a special guest from the Banz Medcare team. Please introduce yourself.
Hi, Dr. Florence Banova. I am the Medical Director of Banz Medcare Limited. I'm excited to be here.
Thank you for joining us. Looking forward to this conversation, learning more about what you do and what you offer. Starting off, what made you adopt the home-based care model?
Several reasons, but the main one is I've worked in the medical field for about 10 years, probably 10 years plus, and the experience in the when you're in the hospital on the other side is that most of the people who turn up very many days later than they should have. They've been trying to deal with their issue from home, from the knowledge that they have. They have been looking for facilities or resources to be able to make it to the hospital. And in medicine, time is very valuable. A day can make a whole lot of difference in how much we can do in the hospital. So the idea has always been there to create a gap, to bridge that gap, so that we can take care of people as soon as they need the help in their homes or in office or wherever it is that you are, and then take you to the hospital when you absolutely need to. So it's been something on my heart, on my mind, because I'm always thinking problem solver. So when the opportunity hit and the timing was right, we created Banz Medcare Limited.
Perfect timing, like right after the pandemic.
Exactly.
You guys also do virtual consultations?
Yes, we do.
What kind of visits can one schedule virtually?
It's mostly conversations with a doctor. We want to also expand it to include specialists and mental health support. So anytime if you sit here and you have a swelling somewhere or you're curious about something that you've been going through, you just get on your phone and schedule an appointment.
Okay. What type of specialists, like cardiologists?
Well, the higher the specialties go, the more nuanced their requirement for physical contact gets. So it's not that easy to make a diagnosis quickly and make a decision. So that's why I'm saying we are just trying to build on that to figure out what actually works and what won't work. So as we build on it, right now what we can do is you get in touch, whoever you get in touch on the other side is a general practitioner. Because we are trained to be able to see that this is an emergency. As we speak, please get into a car and go to a hospital. Or let me have a look at the rush, put a camera here or there, or describe your symptoms. And then we can, through that conversation, we can find a preliminary diagnosis that we are sure of. Then we can make a prescription. If not, then we send someone to you to take off some lab tests or send them to a hospital. So that can be done in the general medicine context. And then the consultants that we have, we then can consult them. So I, as a general practitioner, will consult the physician or the kidney specialist or a cardiologist about the client that I'm speaking with. And we are talking already about what you've told us the problem might be. So we're using your history, we're using, if I've seen you, the physical exam results, and then the lab results. So the consultant will be sort of a third party in the discussion. So we are looking for a way to make them a first contact.
Many people need that, especially warriors. Because when we go to hospital, the process can be quite lengthy. It's a lot of waiting time before you see a doctor.
Yes.
It's unfortunate. So there's still a gender bias in healthcare. How do you think this model will help bridge that gap?
It's difficult to think that in 2023 we are still talking about gender biases. It's very unfortunate, but a lot of strides are being made. This model takes that away to a big extent because by the time you call, the person on the other line is not thinking about how you're dressed, what you look like, who you are. They're thinking, by the time this phone rings, that means it's a patient that needs help.
Yeah.
So it takes that, the biases that are created with physical
appearance.
Yeah, when I see you, I can tell, okay, this is Don, he's a something aged gentleman. That bias goes away. It's not the first thing I think about. The first thing I think about is the phone has rung, that means there's a patient on the other side.
Yeah.
So that, I believe, is helping to take the bias away.
I definitely think it will also. How would you address the concerns of a patient in regards to the services that you offer?
It depends on the concerns. Of course, there are several concerns. Not everyone can afford to use internet-based services. Eventually, we end up having WhatsApp conversations or a WhatsApp call because it might be cheaper than Zoom or even just a regular phone call because you're counting the minutes.
Yes.
So not everyone might be able to access internet access. Not everyone might have the trust that, who am I talking to on the other line? Are they seated by themselves, or are they in a restaurant with so many people here? Or am I on loudspeaker? So all of that can be an issue of concern, that how much can I tell this person who I don't see?
Privacy concerns. Yes,
privacy concerns. And much as we are home-based, we are working on getting into the telemedicine environment, we are still guided by the rules of medicine, the fundamental rules of medicine. So privacy is a big deal, confidentiality is a big deal, and we still follow through with those rules. So we only can take the phone call. When you take a phone call and it's with a patient, you have to be in a private space, nobody is hearing. And even when there's any communications, I will let you know if I have to speak with a specialist about your case before I do. So that kind of communication is always there, and we have an open communication policy. About affordability, we use what you can afford. If it's not going to be possible for you to get onto a Zoom call for me to see you, we'll stick to the phone call until the phone call can't serve both our needs. Then we'll find another way. Either I'll then come to you or we'll find a way of getting you to where I am at. So we use we've as much as possible incorporated all modes of communication into the service so that we can reach as many people as possible.
I think you've covered all the concerns that I had. Mine were just mainly privacy.
Also, all the information that we collect, we still have patient files which are dealt with under the governing laws of confidentiality. So those are also kept safely. Even internally, an administrator with Banz Medcare only has so much access to particular information as opposed to a doctor or a specialist or a nurse. Everyone gets only the information that they need to get.
Decentralized, I guess.
Yes, it is.
We've already talked about some differences, some benefits and some problems someone might have, but what would you say are the benefits of home-based care versus hospital? Like I already mentioned, for warriors, it's a problem when we have to go to hospital because of the long waiting times.
Yes. I think that's the first thing, the long waiting times, but also the time between when you are unwell and when you get to the hospital. Traffic jam, are you on a border? Do you need an Uber? That entire waiting time. And that also affects when you will go, because you're thinking, it's 2 a.m. Let's wait it out. But by the time you reach us at 6 a.m., because you waited it out, you've been in pain for very many hours. So that is taken away, because at 2 a.m. you can still make a phone call and if you can't move or if you don't need to move, you still will get help. The other big advantage, and people are doing some research on this, is the cost is actually reduced. Some research has been done, okay, not here, in the US, where they say the cost of treatment, including things outside of the actual treatment, things like a caretaker and transport and food, and is reduced by 40% if you're taken care of at home.
At home.
Yes.
That's a huge difference.
Exactly. And there's also research that says that readmission rates are also reduced if someone is discharged a little earlier and taken care of at home a little earlier than they would have. Because a lot of the time, if let's say you need to be admitted, you're admitted, and it turns out you're in hospital for 10 days. Sometimes the last 3 days were really, and you're just under observation.
Yeah,
you're doing
better.
We're just making sure you finish all your injections. You know, we are making sure all the lab tests are back and they're good. But you could have waited for those from home.
You could have done them at home.
Exactly.
And saved a lot.
And saved a lot. And also, hospital is a hospital. It is very sanitary. They're cleaning up all the time. It's the next door person is probably about to give birth, so they're screaming in labor. The next one is a child who is crying all night.
Yeah.
The next one probably had their leg amputated. You absorb all the emotions that are going on around you in the hospital.
Increasing your stress.
And there's a nurse that's checking on you every 4 to 6 hours. They have to take your pressure. And we won't say that, for Dawn, I think he's stable, just check him twice a day. For the others, so they'll have to do around every 6 hours. Even if you're asleep, they'll come and wake you up and check your temperature, check your... So you probably don't sleep well throughout the night. You don't sleep well throughout the day because you have guests. You have to get up and eat at a certain time, even if you're not hungry, even if, you know, so the disruptions in a hospital setting, which cannot be taken away because that's how a hospital is supposed to be, disrupt your healing process. Because we also, at the same time, we are telling you, you need to rest, get off your phone. You need to not think about the stresses outside, but you're in a stressful environment, unfortunately. So if you're at home, the timelines can be managed better. You're around people that you recognize and you know. You can manage who visits when. You can decide, I want to watch football and I want to watch it in the couch. Unlike being in a room that only has a bed. You can decide, okay, for now I need to take a walk, even if it's 4 p.m. or, you know, a bit later in the night, but you're in your compound. So the healing environment in the home is better for the mind and also better for you physically. So that's the upside to it. So the wish with Banz Medcare is to make sure that yes, at some point you will need hospital. You might need hospital, but only if you absolutely need to.
I think another upside I can think about for home care is the personal approach between doctor and patient or nurse and patient. Because when you go to a hospital, they all look at you like exactly the same because they've been doing their rounds, like you said. So in their eyes, everyone is just a patient. Their needs are not, they're not adjusted for their condition. For
everyone's condition, because they're dealing with 100 people, 40 people at a time.
So that personal connection is not there. They're very unemotional, very detached. So even when I get sick, I definitely prefer recovering from home.
It's what the body needs. It's just that, you know, hospitals have to be there as well to sort out certain things.
Is this something patients with chronic illness consider home-based care in your history?
Very much so. most of our clients who actually approach us have a chronic illness, and it's because of a chronic illness. And it's mostly because when you have a chronic illness, you are in contact with a health person very frequently.
Yeah.
But it also means you have to be in hospital very frequently. And sometimes those just check-up visits. I'm here to get to have a look at my HB. I'm here to get my blood sugar checked. But I have to sit through a queue.
Yeah, even if there's nothing wrong, just a regular checkup.
Yes. So then it becomes, every time you have to think about the fact that I told you, you need to come to me every 3 months so we can check your blood sugar, we can check this. Every time that date comes, you're thinking, no. But if I then tell you, I can come and do those tests from home, or I can come and take off the samples I need to take them away and then give you a call and say, this is what your blood sugar looks like, let's have this drug adjusted, and all you have to do is just be available for that 30-minute checkup wherever it is you are, office, home, wherever it is you are. Definitely anyone with a chronic illness will jump to that.
No traffic, no stress,
no waiting time. Even the anxiety, because it's the anxiety of having to be in a hospital is real, because we even have what we call white coat hypertension, where some people, whenever you check them in the hospital for their blood pressure, it's high.
Really?
Then you give them a gadget to check themselves at home.
And it's much lower or lower.
It's normal.
Yeah.
It's normal. They come back a week later and they've checked every day at a certain time. And it's the figures you see there are totally different from what you see when you check them. And it's proven, white coat hypertension. So the anxiety of being in a hospital, even if you are, you say I'm hardcore, I've been in hospitals all my life, it's in there somewhere in the background. Or you could get there and you're like, you know what, I'm feeling fine, I've just come for my checkup, I'll sit through this, I have my book, let me sit through this. Then they'll bring in a very sick person. Then a child will run past and they're, bleeding. So what is happening in the hospital environment while you wait is going to throw you off.
You're just absorbing all of it.
Exactly. So it is definitely something that would be advantageous for chronic illnesses. It would be advantageous for even finding those chronic illnesses, screening for them.
Yeah.
While you're in your office, we come in, check, make sure you're fine, or if you're not fine, we find it early. Other than waiting for you to come when there's complications.
I'm one of those people who doctor will tell me come in 2 months and I'm just dreading it, so I push it another month and then I push it another month.
Soon it's a year later and you're there because it's a crisis.
Exactly.
It's something that would work, and for us, speaking from the medical personnel perspective, there's less complications. Then we see people earlier than before the complication comes. So we are preventing complications. We are preventing seeing people at closer to end stage or death or an actual complication that we can't reverse.
Prevention is always the best method.
Yes, it is.
What would you say are the limits to virtual consultation and home-based care?
And home-based care.
You already mentioned that the need for specialists when that comes up.
Yes, that, and then we definitely need tech, AI, to do the virtual healthcare better. So that's a limitation, definitely. I don't know how far away we are as Uganda from utilizing AI and high technology. Best, I don't know. I don't know. But it would definitely make a lot of difference if, one, internet was not expensive.
Not so expensive.
It would make a lot of difference, because that would mean as many people as possible can chat on WhatsApp, or we can jump onto a Zoom call and we can see that, the patient can see a person's face on the other side, and I can see the patient. So that's one of the limitations. We are still a bit behind on technology, but we are also behind on making it, even the technology we have isn't still not yet that accessible because it's still expensive. Another thing is mindset. There are still a lot of us who, if I am not looking at you as my doctor or as the nurse or as the specialist, I haven't seen you. I'll give an example. There are times, you see a patient and you talk through the symptoms, you get them checked, and the treatment is not medicine. It's maybe advice on something. Maybe you need to sit better, or it's not actual tablets, so you give them a cream. But the mindset is, if I go to the hospital, I need to come out with an envelope of tablets or medicines or something. The times you hear comments like, the doctor didn't even touch me, or didn't touch the place that I said was hurting. They touched another place. Or you're wondering why they used a stethoscope on your chest just because you came and said you have back pain. So the physical element is still in our mindset, which is understandable. And even with the development of technology and AI, I'm not sure we will be able to get rid of the mindset, but also, technically speaking, I don't think we will stop touching patients as doctors. The need to touch the patient and examine them, I'm not so sure we are ever going to stop that. But also, again, mindset-wise, not a lot of people can trust that. Just after talking to me, I might be able to say... Diagnose correctly, or say, let me send you someone to take off lab samples, and when I see your lab samples, then send you medication. Without you having seen me, without me having touched you. So,
like those trust issues there.
Trust issues and an understandable mindset. Because even I'm not sure I'll, call me old-fashioned, but I'm not sure I'll be able to work in a system where only a robot is
making all the decisions,
without my input, without me seeing and touching.
I think physical examinations will always be necessary.
They will always be necessary to a very big extent. So it's both ways. It's a limitation, but it's an understandable limitation.
Definitely. Interesting times we live in with AI. When you look at the general direction of improvement healthcare delivery, what threats and opportunities do you see AI providing, influencing?
I'll start with the opportunities. I think from the start I've been talking about how we are limited. One of our biggest limitations is how far behind we are with technology and AI. It would make a whole lot of difference if I can reach someone faster, if internet is less expensive, if gadgets are less expensive. It would make a whole lot of difference. That would mean that one doctor can take care of a lot more people all at once. That would mean that information on a gadget that you're using can reach me with just me clicking on my phone and seeing that your blood sugar is low, your pressure is this. Let's get this done. It will make a whole lot of difference if gadgets like insulin pumps are accessible to everybody. Because it's a pump, but it can tell that, okay, your insulin is low or your blood sugar is high. It increases the dose without too much tinkering and interference from anybody. We do need the technology, we do need the AI, we need to advance that a lot faster because it makes things more efficient, it makes things easier to manage, it takes care of the doctor-patient gap because we are still at one doctor for every 25,000 people. The recommendation by WHO is 1 to 1,000.
1 to 1,000.
Yes. So, and the count, that 1 to 25,000 includes doctors who are in public health.
Public and private.
Yeah, public and private institutions. So that figure might be bigger. Yeah.
Wow,
so technology would definitely cover that gap.
Yeah.
Because then I can manage 20 patients
very
at once,
easily,
as opposed to me managing those 20 patients in less than an hour because I'm under pressure in a hospital and I'm looking at the queue and I need to get through everyone quickly. So my emotions are off. I haven't eaten. I am stressed. So my patients are stressed. So we do need the technology. We do need AI.
Can't wait for us to reach that point where it's just easily accessible.
Are you in tech?
I dabble here and there. It's not my specialty, but my brother is very much involved in tech and he's obsessed with everything that's happening right now. He has a subscription for ChatGPT.
Oh, wow.
Yeah. He codes himself, so he wants to start building AI models. So maybe in the future, he can help us build a model for the health sector. I don't know.
That will make a difference. Very, very big time difference.
Something I've definitely thought about.
Yeah. Because, I know that maybe some countries are way ahead of us. I just don't know how many years we have to catch up and then move even higher.
Yeah.
The setbacks of technology, of course, anyone can hack into a cloud these days. Even hospitals, thankfully in Uganda that's not happening. Hopefully it doesn't happen, but hospitals are being ransom attacked with take over all the gadgets and
hold the data and you have to pay a ransom.
So there's that side of it.
We'll deal with it when we get there.
Definitely, because we do need it. I think we already talked about this, the trust issues. You wondering, okay, who am I talking to and who is listening in on this conversation? Who is going to see these texts that I'm sending my doctor? And what is this cloud that they're sending information to, and how many people in that organization have access to that information? And of course we work around that with encryption and anonymization of information, and as much as possible work with what we have. But as a patient, as a client, you have every reason to be, because even our mobile money is not 100%. We still have safe trust issues with our mobile money. What's in the bank? What's happening? Who's seeing what's going on? So it's a double-edged sword that we learn to live with as we progress. But we definitely need the progress.
Yeah, I agree. It's been an enlightening conversation.
This has been interesting.
Yeah.
I like it when I don't have to talk about Panadol and and morphine doses for even just an hour. Yeah, so I like this.
So people might not be aware, but we have a partnership with Banz Medcare, and it's working out very well. You already know I have you on speed dial. Just in case if I feel a slightest bit of pain, like at 2 a.m, I know I could have someone to call.
Yeah.
So I would just like you to speak on how it's working out on your side.
Okay. So our partnership, I'm glad you're saying already that it's working out very well. And one of our taglines is actually, healthcare professionals on speed dial. The partnership was created, and it's there's a special package for the warriors, and of course they are caretakers. What that package includes is that we have a database that we are working on to make sure that anytime a warrior calls, we know that this is a warrior. It's not a different kind of patient, and that dictates our reaction time, how we manage it. You're not going to go through a secretary and a front desk person, and then before you speak to a health professional. So you definitely jump several queues, which I would like to, maybe it's, you know, VIP treatment. And we are working to keep improving that process. And also the costs are slightly lower. So there are some things that are waived for the warriors. We also are building on our side because we're also a growing business. So as we grow, as we increase on the tech and the access to gadgets and access to information, we have the sickle cell warriors in mind. So some of the things that we are creating are also specifically specialized towards
for the
warriors or for people living with chronic illnesses.
It's really nice to have that. Again, I really appreciate it. Thank you so much.
Thank you for having us. Thank you for taking a chance on us with all the pros and cons of telemedicine, and because it's a learning curve. Telemedicine is still new in Uganda, so it's a learning curve for us, and we appreciate you taking a chance on riding the wave with us. Yes.
There's nowhere to go but up.
Exactly.
Thank you for being here again. Really appreciate it.
Thank you for having me. Yeah.